Now, I've been watching the issues in Congress, and I've been encouraged by a few things, but I've also been discouraged by a few things. First of all, when Hillary introduced the bill in 93, she kind of wrote it with a small group of people and threw it into Congress and said, we need to pass this. And Congress, it had too many details, and I think Congress was overwhelmed by it, and they were swayed by the lobby and it didn't pass. This time, it's Congress that's actually writing the details of the bill. They're holding the hearings, they're getting an input from the White House, and I think that they're playing an active role in writing the bill. Next thing is that this president is seeking feedback on health care. You know, he's holding the town hall meetings, he's getting feedback through his website and emails. I think that's been very valuable. I think it's debatable how much they're, hearing it, but I think it's a very valuable tool to give the White House feedback. And of course, I think we're seeing a level of commitment from Congress. I think the Democratic Congress is committed to health care reform, and they're committed to get something passed, and that is reassuring. Now, there's other things that are discouraging at this point. We're starting to see Congress being influenced by the healthcare industry and lobby. Unfortunately, there was a recent article that showed that a lot of legislators are actually funded, their campaign coffers are they're very deeply funded by some sort of sector of the healthcare industry. And we have to be very wary of that as far as where their motives are coming from. We have to fight that with constituency input and hanging our vote on this issue. There also seems to be a pervasive unwillingness to consider the single-payer system. And this is an ideology that we have to fight very strongly. Because you hear so many legislators, including Senator Max Baucus, that was holding hearings on health care, rejecting single-payer advocates from even being in the room. And, that's a huge obstacle that we need to start knocking down. And while it's discouraging, we're seeing people fight against it, and we need to take advantage of this momentum. Lastly, we're starting to see a bipartisan approach to healthcare reform disintegrate into partisan bickering. And we need to work very hard to make sure that in order for us to get something passed, that enough people in the majority and the minority can buy into something that's going to make it through. So, what's happening right now? What is actually being worked on? Well, Obama introduced his plan. He has a national health insurance exchange system where the private sector will introduce insurance policies that have to meet certain requirements. They have to contain a minimum comprehensive benefits, which include hospital care, outpatient care, drug coverage. And it has to be affordable, reasonable co-pays, reasonable premiums, reasonable deductibles. Now, the word reasonable is what's being debated right now, but that's the intent, is to create policies that have a minimum amount of benefits that are affordable, and for those who can't afford it, there's going to be sliding scale subsidies to extend that. Medicare will maintain intact. Medicaid will be expanded, as it already has been, through the S-chip legislation that recently passed. So the idea is to expand Medicaid, keep Medicare there, and provide a national health insurance exchange for employers to enter, for employees to enter, for self-employed people to enter to pick their policy. Now, in addition to that, the employer will be responsible for helping the employee get health care. And one of the details that's in the plan is a play or pay type of mechanism where an employer, regardless of size, has to either pay for their employees' health insurance by going into the self-insurance exchange and buying a policy for their employees, or they have to pay into a trust which would fund subsidies for people who can't afford it. So the employers will be contributing to some extent across the board into this plan, and that's not extremely controversial right now.